Shane Foss, founder, CEO, Hooray Health, is with us in studio. Shane, welcome to the show.
Thanks, Michael. Great to be back.
All right, I'm glad you're here. All right, Shane, you're our healthcare expert. Tell me what's latest in the news with politics, geopolitical events that are talking about healthcare. What's new? What's changed since we last saw you?
So I think the biggest thing is really the individual mandate. The removing of the individual mandate that happened with the tax bill was the largest change that's going to affect a lot of Americans. You know, if you look at how it breaks out today, 13% of Americans are actually uninsured, right, which is actually down from closer to 20% pre-Obamacare. So it still means that 33 million people are uninsured. And I think that what people think about is, okay, they're unemployed, they're not going to get a penalty, which is actually untrue. 73% of them actually have a full-time job. And so there's that individual mandate was, hey, you've got a max penalty and you're going to pay it. And you've got, if you have that issue this year, that mandate is going away. And so I think that's going to open up a lot of opportunity for individuals. The other thing that Trump's been talking a lot about now is the association health plans.
What's that all about?
So an association health plan, they're around today, but they're regulated a little bit differently. But so today you have to have a specialized reason to have an association health plan. And so you have to, like Direct Sellers of America would be an association, and so you would get direct sellers to join your network or your association, and they'd have access to your health care. But again, you have to register with the state, and it's a little more challenging. And so what Trump has done is his proposal is really to remove the barriers of creating this association, and now you can actually simply create an association with a new proposal just to share health care benefits. And so what that does is that gives small employers the opportunity to band together and actually be able to purchase health care instead of just with maybe their 3 employees, now with thousands of employees that are joining this association. And so I think that's a really big opportunity moving forward. And that's actually one of the tools that we used for our individual market. We sell Hooray Healthcare through an association. And so it just makes it accessible to everyday people.
How does that affect us on the bottom line? Can you give us either a percentage reduction in cost with these new changes that are coming, or dollars and cents for somebody that it's going to end up writing the check for this?
Yeah, sure. I think it's going to vary, but I think that you can look at savings anywhere from 20 to 30% based on volume. So if you have a large association, have a large participation, the buying power is much greater in that situation. But also, when you look at it from an insurance standpoint, the more people you have, then that the risk pool is reduced, right? I mean, the risk pool is greater, but the risk is reduced for the insurer, so they can lower those premiums, and so everybody wins. So I think Trump is really on the right path here.
When do you think we'll get through this process so that we can start implementing that?
Government's hard to say,
Right.
but it looks like they're moving pretty quickly. I know that they've already got their proposal in, and I know that the different states are looking at the proposal. So hopefully within the next couple months.
Oh, that's good. That's good. That's quick. All right, before I move into any of the questions that I may come up with, just what else did you want to bring to the table about what Hooray Health is doing that separates them from the rest of the world?
Yeah, sure. So Hooray Healthcare is very exciting. It's a passionate project for me because I think everybody in America, what they struggle with is really accessibility. They can't afford it, and it's very, very confusing, right? And so what I mean by accessibility is the fact that you think somebody's in network, and you go there, but yet you still receive this bill afterwards that says, well, yes, you paid your copay. Now you owe the remaining balance for your deductible. But the contract didn't cover X, and so you have to pay for that. And it's very confusing. And so the other part of it is they make it very difficult for you to find your actual in-network provider. And so, so we really looked at it a different way. We really started with the member and thinking of it as, from my own experience. And so we created this mobile app that so you have 24/7 access to all of your providers. We actually created and integrated a discount RX card within the app. So as soon as you get your prescription, you can get the lowest price out of the top 10 retail pharmacies in the area. And then the most important thing that we did was we actually went out and built our own provider network of urgent cares around the United States. And
how many do you have?
So we have just under 2,000 today. We are on pace to have around 4,000 by the end of the summer, 2018.
Nice.
So, yeah. So you've got plenty of access. And what we did was it's a $0 deductible. It's a $25 copay, and the contracts that I signed with the urgent cares, they accept our payments in full. And so you don't have to worry about those excess bills and coming back and saying, hey, we need another $100. So we've really kind of put the market on its ear that way, because we really kind of took a different approach looking at it from the actual member. And then we really took it one step farther, because when you look at late night and you end up going into an ER, and you end up with a $3,000 bill for maybe an earache or maybe a sinus infection, we created a concierge group. And we have a 24/7 access to paramedic and EMTs that have physician oversight.
Oh.
And you press the call button, you call them from the mobile app, and they will actually triage you medically. And if they may say, hey, you know what, it sounds like you may have a sinus infection. Is this something common? And a lot of people say, yeah, I get it every year, and I usually get a Z-Pack. Well, why don't I just prescribe you a Z-Pack? And so that saves you that trip in at 1 o'clock in the morning to the ER, and there's no cost to that to you except for the cost of the Z-Pack.
Yeah, I mean, I recently had to get a Z-Pack. I wish I would have already had Hooray Health on my plan with you. I'm going to engage with you and get your Hooray Health plan with our company, because I can see that between the first of the year and now, the entire country is down with this. And if we have that many people that can't have access to good health care because they can't afford it, they don't know where to find the right processes to work through, we need to get the word out.
Yeah, so it's funny you say that, because I actually came down with the flu over Christmas, and I actually got over it pretty quick, but then I came down with something else as related to the flu, and so I went into urgent care. I got on my app, $25. I was in and out in 20 minutes, and my prescription cost $35 for Augmentin. It was great.
All right.
So
real quick before you go, Shane, contact info so they can get the app and sign up with you.
Yeah, so you can get the app on either of the Android store or the Apple store, and we're at www.hoorayhealthcare.com.
Thanks for getting us up to speed, Shane.
Thanks. Appreciate your time, Michael.
My pleasure. All right, Shane Foss, Hooray Health. You've been listening to CEO Money with Michael Yorba. Thank you for joining with us around the world and here domestically in the Dallas-Fort Worth area. We'll be back tomorrow. More great content for you. Segment is brought to you by Hooray Health.